From a guide within us all,
The power really is in the numbers.
to a blueprint for our future.
I was really excited to come here to Rogers when I found out about the biobank.
The Biobank at Rogers Research Center is opening doors
We're proud to be one of the pioneers in that space.
to a new future of mental health treatment.
There's a lot we can do once we understand genetically what genes are predisposing those patients to see those symptoms.
Dr. Kelly Parsons, Director of Research Administration at Rogers Research Center, says by exploring how genetics are tied to mental health, we can eventually better tailor treatments to each person. But to do so, we need to work together.
These aren't simple things like cystic fibrosis where there's one gene that causes that. It's going to be very complex.
Luckily, there is strength in numbers.
To see any statistical differences in patients, behavioral health patients versus controls, you just need lots and lots of genetic samples to be able to accomplish that.
So one by one, Rogers Research Center is collecting consenting patients' genetic samples, a process started in 2022.
To go from nothing, an empty room, into something that is quickly becoming one of the larger mental health focused biobanks in the world, I think that is huge.
And it all adds up to something extraordinary. Rogers strives to ensure that no one patient is treated as just a number.
Every single project that we work on at Rogers has to have a clear line to improving the patient care that we're delivering at Rogers, or we don't do it.
Dr. Sheldon Garrison, a founder of the Biobank, says genetic insights can lead to increasingly individualized care.
Once we better understand the genetic profile of our patients, which we'll understand in the next 2 to 5 years, we can start integrating more appropriate, suitable, and impactful genetic testing into the care here. So then when our providers do notice something that's a little off, or when the families or those affected themselves share that something's just a little bit different for them than maybe for others that they know, we start to offer different genetic tests or resources, or bring them to the providers that are going to provide those answers for them.
I think we have a great foundation.
Rogers is working alongside other research organizations around the globe, says Dr. Kelly Piacsek, Executive Vice President of Research.
I would envision 5 to 10 years from now that we're a choice partner in behavioral health research, that some of the discoveries that have come through our biobank and our neuroscience lab are helping to inform the broader field and changing the practice of care in the behavioral health field.
Our unique genetic code makes us who we are, and insights from thousands of genetic samples can pave the way to who we will be.
I really hope that we'll be up into the tens of thousands of patient samples in the biobank.
Driving mental health care forward here at Rogers.
Great things will come for the field and for our patients.
Always available at the intersection of hope and healing.